Hi, welcome to Everyday Nursing Knowledge Lectures, and today we will learn settings and modes of mechanical ventilation. What is mechanical ventilation? Mechanical ventilation is delivery of positive pressure ventilation. That means air with positive pressure is delivered to the patient, to the lungs, when a patient is connected to ventilator, and it is delivered through endotracheal tube or through tracheostomy tube. It is indicated when a patient cannot breathe by their own, or cannot keep the airway open, or patients in respiratory failure. Now let's see settings of mechanical ventilation. What is settings? Settings are numbers or parameters adjusted or set in the ventilator to provide adequate support to the patient, and the settings are ventilator mode, tidal volume, frequency or rate, FiO2, inspiratory flow rate, IE ratio, sensitivity and PEEP. Now let's see settings in detail. First is tidal volume. Tidal volume is volume of air that moves in and out of lungs during normal breathing. And in ventilator, tidal volume is set anywhere from 5 to 10 ml per kg of ideal body weight. So in ventilator, you may see set tidal volume as 350, 500 or 450. It depends upon patient's ideal body weight. Second is frequency or rate. It is same as respiratory rate, that is number of respiration given to the patient by the ventilator in 1 minute, set anywhere from 10 to 20 breaths per minute. So this is all initial settings, and this settings numbers may vary depending upon patient's condition and ABG. Third is FiO2. FiO2 is fraction of inspired oxygen. This is the percentage or concentration of the oxygen given to the patient. Immediately after intubation, FiO2 is set anywhere from 30 to 60%. At times, if the patient was on higher FiO2 prior to intubation, patient may need FiO2 up to 100%. Example, patient was on BiPAP and patient was receiving 100% of FiO2. Immediately after intubation, FiO2 is set as 100% and gradually it's weaned down depending upon patient ABG and PaO2. Next is inspiratory flow rate. This is the rate or speed or how fast the set tidal volume is delivered by the ventilator, and it is anywhere from 40 to 60 liters per minute. Next is IE ratio, that is inspiratory to expiratory ratio. That is the ratio of inspiratory portion to expiratory portion, and normally it is 1:2 to 1:4. A longer IE ratio is set when a patient having obstructive disease, example in COPD. This is because of air trapping. Now sensitivity. What is sensitivity? It is the negative pressure or the effort patient has to take to get a breath from the ventilator, and it is between -1 to -2 centimeter water. And finally PEEP. PEEP is positive and expiratory pressure, that is pressure in the alveoli at the end expiration. This PEEP helps alveoli from collapse. So when we breathe in, alveoli inflates, and when we breathe out, alveoli deflates. So when there is a positive PEEP, it helps alveoli from collapsing and improves the gas exchange. It is set anywhere from 4 to 6 centimeter water. But in certain patients with refractory hypoxemia, that means patient is receiving high FiO2, but these patients are still hypoxic, they need a higher PEEP to keep this alveoli open. And this is seen in ARDS or in COVID-19. So when you take care of patient with high PEEP, you have to remember this high PEEP can increase intrathoracic pressure and can decrease the cardiac output. Now, before moving to modes of mechanical ventilation, you have to be familiar with two more terms. That is peak inspiratory pressure. It is also called P-peak and plateau pressure, P-plat. So the peak inspiratory pressure means peak pressure during inspiration. It is the highest level of pressure applied to the lungs during inhalation. It should be less than 35 centimeter water. Whereas plateau pressure is pressure during plateau phase. That means pressure in the alveoli during plateau phase, that is at the end of inspiration, and it should be less than 30 centimeter water. If you see a ventilator alarm and if it says P peak or peak inspiratory pressure high, and if you see a P plat high, So the pressure during inhalation and pressure at the end of the inhalation is high. It's because of the abnormal lung condition. It's because of the patient's abnormal lung compliance. Whereas if you see peak inspiratory pressure high, P peak high and a normal P flat, that means pressure during inhalation is high, whereas pressure at the end of the inhalation is normal. That means somewhere there is an obstruction to the airflow. It indicates there is increased airway resistance. So this can be because of secretion, or patient is awake and fighting or biting the tube. So make sure the patient is sedated. You can suction the secretion out and you can inform respiratory therapy. Now let's see modes of mechanical ventilation. In modes, we will be going through most commonly used mode. The first is CMV. CMV is continuous mandatory ventilation. In continuous mandatory ventilation, the ventilator delivers a preset tidal volume and preset respiratory rate. Example, if the tidal volume is set as 500 and respiratory rate as 10, this ventilator will provide 10 breaths per minute, and each breath will have 500 ml of tidal volume. So when you take care of patient with CMV, you have to remember the patient is with full ventilator support. That means ventilator is doing all the work of breathing. If the patient wakes up and it starts to initiate breath, ventilator will not sense patient breath. Ventilator dysynchrony happens. There will be increased intrathoracic pressure because patient is trying to breathe. The ventilator is delivering breath. So the intrathoracic pressure increases. That can lead to barotrauma. So patient with CMV mode, you have to remember these patients should be well sedated, or the patient has to be on neuromuscular blockage or chemically paralyzed. In CMV, it can be pressure control CMV too. That means instead of tidal volume, pressure is set. So in pressure control CMV, there will be preset pressure and respiratory rate. And in pressure control CMV, during each breath, the preset pressure is delivered. Once it reaches the preset pressure, exhalation begins. Another mode is AC, that is assist control. In assist control, again, the ventilator provides set tidal volume or pressure. You can set either tidal volume or pressure, and this is delivered with each respiratory rate. The difference from CMV is in AC, in assist control, patient may trigger additional breath above the set rate. That means patient can take spontaneous breath. So the ventilator senses this additional breath and it allows patient breath, but during patient breath, the preset tidal volume is delivered. Example, if the preset tidal volume is 500 and the set rate is 10, that means in 1 minute, 10 breaths is provided to the patient by the ventilator, and each breath has 500 ml of tidal volume. But if patient takes 2 more breaths in 1 minute, the ventilator senses that breath, and when patient initiate that breath, ventilator will provide this 500 ml of tidal volume. So in 1 minute, if the patient takes 2 more breaths, the total number of breaths in 1 minute will be 12. That means 10 from the ventilator and 2 by the patient. But in each respiratory rate, including the ventilator breath and the patient breath, 500 ml is given by the ventilator. The third mode is SIMV, that is Synchronized Intermittent Mandatory Ventilation. In Synchronized Intermittent Mandatory Ventilation, again, we can set either preset tidal volume or preset pressure, and this will be delivered with each respiratory rate. The difference of SIMV from assist control is it allows spontaneous breath, but during the spontaneous breath, patient will have patient's own tidal volume, whereas in assist control, ventilator senses the breath and provided preset tidal volume or preset pressure, whereas in SIMV, the ventilator will provide preset tidal volume in preset rate, and if the patient starts patient's own breath, it will be independent of ventilator breath, and the tidal volume may vary. And this is used as one of a common weaning method or one of the common weaning mode of mechanical ventilation. Another mode is PRVC, that is pressure regulated volume control. In pressure regulated volume control, pressure is regulated along with a set tidal volume is delivered to the patient. Next is Cpap. that is continuous positive airway pressure. In CPAP, a positive pressure is provided throughout the cycle. That means during inspiration and during exhalation, a positive pressure is maintained throughout the cycle. So when a patient is on CPAP, you should not sedate the patient because patient should initiate all breath. There will be no preset tidal volume, there will be no preset respiratory rate or no preset pressure. Patient should initiate all breath, and this is usually used prior to extubating the patient. Next is pressure support. In pressure support, again, patient should not be sedated. Patient has to initiate breath, but the ventilator support the patient's breath by providing a pressure or preset pressure just to reduce the workload of breathing. The last mode is volume support mode. In volume support mode, again, the ventilator support patient's breath to maintain constant volume. At times, combination modes are used. Example, SIMV with pressure support or SIMV with volume support. And it all depends upon the patient condition. So today we learned about settings and modes of mechanical ventilation, and thanks for watching my video.